I want to go ahead and introduce our amazing speaker today, and I personally am very excited about this webinar to learn more about the different apps that are out there. But today joining us, we have Dr. Joy, who is the Senior Medical Director for the Wellness and Nutrition at Intermountain Healthcare. Here she practices family medicine and sports medicine at the Salt Lake Live Well Center and is also an adjunct faculty member at the University of Utah School of Medicine in the Department of Family and Preventative Medicine. She is also the past president of the American College of Sports Medicine and the Female Athlete Triad Coalition. She also serves on the Exercises Medicine Governance Committee for the ACSM, chairs the EIM Clinical Practice Committee, and serves on the Board of Directors for the National Physical Activity Plan Alliance. Needless to say, she's very busy, and I can tell you I've collaborated with Dr. Joy multiple times and have had the privilege of just soaking in all of her knowledge and information, and I know she's passionate about all of these things, so I'm really excited to hear about the different apps that are out there, because I'm sure you are equally passionate about that. So welcome, Dr. Joy. We're happy to have you here today.
Well, thanks so much, Lynsie. And this is one of my favorite topics, and I'm glad to see so many people joining us today. And I think this is kind of an all teach, all learn session. You know, I'm going to share with you a little later that there's more than 200,000 health and fitness apps out there. And so it turns out I haven't reviewed them all, just a handful. And so I'm really looking forward to hearing from you. So throughout this presentation this evening, I want you all to be active participants, pun intended. And please put your favorite apps into the chat. And Lynsie is going to monitor the chat. And when we get to kind of the Q&A section of our presentation this evening, we may ask some of you to come off mute and talk a little bit about your favorite app and why it's your favorite app. And so we'll all learn together about, is there an app for that? So I'm going to go ahead and share my screen. All right. Okie dokie. Here we go. So I just thought I would frame up the conversation this evening. I'm going to start out by talking about smart devices like Fitbits and Apple Watches. And it's interesting to learn that 1 in 5 Americans actually use a Fitbit, an Apple Watch, or some other wearable fitness tracker. So these are very, very popular. And then we'll talk about apps, and there's certainly a lot that we could talk about. Like I said, more than 200,000. But I thought we would focus on physical activity and fitness, healthy eating, and mental wellness. And then last but not least, we want to hear from you. So please share your favorite app or apps and why. And please put it in the chat and we'll get to as many of you as possible. And I found this statistic also quite interesting, that it's forecasted that by 2022, so next year, there will be 86.3 million users of health or fitness apps in the United States. So indeed, these are very popular, and it's really how many people connect with information about health and wellness. All right, so let's start out with just a little bit of FYI about Fitbit, which was founded about 14 years ago. Since 2010, they have sold more than 105 million devices worldwide, and it's estimated that they have 30 million active users on their platform. So again, a very popular way for people to track their physical activity and physical fitness. And in 2020, they sold just under 11 million fitness devices in the midst of the pandemic. So I could share a lot of research with you that is done using Fitbits, but I thought this one was kind of interesting because it happened during the pandemic. And this is Fitbit data that was collected, and it's looking at the relationship between physiologic and behavioral changes that occurred during the COVID-19 pandemic. And the graph on the left is looking at change in resting heart rate in people who were either COVID positive in orange or COVID negative in blue. And on the right is the change in step counts for, again, people who are COVID positive in orange and COVID negative in blue. And I'll just point out that it took 95 days for people who were COVID positive to get back to their baseline resting heart rate. I thought that was really interesting. And when we look at step counts, it took about 50 days for people who were symptomatic with COVID to get back to kind of a baseline level of physical activity. So data, this was published in JAMA, the Journal of the American Medical Association. So Fitbit Data is big data, and it is being used, not only by Fitbit, but it's being used by investigators. And this big data is also big business. And the global smartwatch market, for example, is estimated to be $59 billion in 2021. I wish I'd invested in that a little sooner. Okay, so 10,000 steps. You've probably all heard this. And Lynsie helps design Intermountain's 10,000 step program. And Lynsie, you probably know the answer to this, so you don't get to guess. But let's ask our audience of participants, where does the recommendation to achieve 10,000 steps come from? So I'm going to give that a little pause. And Lynsie, you can see if people respond in the chat. Where does the recommendation for 10,000 steps come from? Does it come from the World Health Organization, the Centers for Disease Control, Physical Activity Guidelines for Americans? Where do you think it comes from?
I think you might have stumped them.
Okay. All right. Well, guess what, you guys? It was a marketing campaign. The origins of the 10,000 step recommendation are not scientific. In fact, pedometers sold in Japan back in the 1960s were marketed under the name Mampo-kai, which actually translates to 10,000 steps meter. So, we have all recommendations around 10,000 steps, but it's not really based in science. So what is the science around steps? I thought people would be interested in this. So I promised not to make this talk too researchy, but I did think this was kind of an interesting study. This was done by a gal named Katrine Tudor-Locke. She's a very good scientist, and she was interested in looking at steps and cardiometabolic health. And so she looked at, you can see about 3,400 participants who were 20 years of age and older. And she found that steps per day for men ranged between about 2,200 and 12,000, and for women between about 1,700 and 9,800. And what she saw was a very positive relationship when you start to divide steps per day into quintiles, so 5 groups, and then also looking at 30-minute cadence. And that means how fast were you going? And that's a measure of intensity. Obviously, if your cadence is slower, you're having a more casual walk. If your cadence is a little bit faster, you may be having a moderate intensity walk. And faster yet, maybe it gets to brisk. And then she looked at it relative to body mass index, measuring your waist circumference, weight, and insulin level. And she found a very strong positive relationship there. And so the bottom line here is the more you walked, the more metabolically healthy you were. And that's probably not terribly surprising, but I think it's just of note, especially when we look at women. You don't have to hit 10,000 steps a day, in order to have a positive health outcome. This is a question I get asked a lot. Does Fitbit use actually increase physical activity? Or is it just kind of a nice watch that comes in cool colors? And I'll just say that these results are a little bit mixed, but in general, I would say yes. And again, I could have, shared lots of studies with you, but I picked this one. And this was I think, well-designed study. It was a randomized trial. It was a Fitbit-based physical activity intervention for women. There were 51 previously inactive, overweight, postmenopausal women, and they were randomized to a 16-week Fitbit intervention or a pedometer comparison group. And the Fitbit group increased their moderate to vigorous physical activity by 62 minutes per week, and their steps by 789 per day. And that compared to very non-significant increases in the pedometer group. And 62 minutes a week, I mean, that's significant, right? Because we recommend that people get 150 minutes per week of moderate to vigorous physical activity in order to meet the physical activity guidelines for Americans. And so I think that's a pretty significant improvement when you get nearly halfway, in 16 weeks. And the people who were in the Fitbit group, they liked the tracker. They wore it on 95% of days. They liked the website, and all of them said they liked the tracker. So I could share other results in other populations that are not quite as positive, but in general, excuse me, the data around whether or not Fitbits actually increase physical activity is a little mixed. It depends on the population, but it's generally positive. All right, so let's segue to smartphones, because that's kind of where our apps live. And I'll be so bold as to say that smartphones are the most powerful tool that we have. I mean, my goodness, the smartphone can do more than big mainframe computers could do, certainly when I was much younger. And sometimes we think that smartphones are only for the people who can afford it. And smartphones are really only for kind of, the younger generation who are more techie. But in fact, I actually pulled this data from Pew Research just the other day. So this is as most current data we have on smartphone ownership. But 85% of Americans have a smartphone. And that's like all Americans. 96% of 18 to 29-year-olds. That doesn't surprise me at all. I know, my 20-year-old and my 23-year-old, their smartphone is practically surgically implanted in their bodies. 95% of 30 to 49-year-olds, 83% of my cohort, in the 50 to 64-year-old. And again, I think there's a misconception, that smartphones, again, are only for people who can afford them, that they're too expensive. But in fact, 3/4 of people who we would define as low-income Americans have a smartphone. And it's important to realize that that's how many of our lower-income patients, caregivers, members, that's how they access the internet. And so it's really important for them, to have a smartphone, since that's how they access the World Wide Web. All right, so I've kind of already alluded to this. I update this slide every couple of years, and I've seen these numbers grow considerably over time. That, when you combine apps available on the App Store or through Google Play, there are more than 200,000 health and fitness smartphone apps, which was why we want to hear from you in terms of, what are the apps that you find to be most helpful in helping you achieve your health and fitness goals. And again, the majority of these apps focus on exercise and fitness, followed by diet tracking and stress relief. Okay, so let's start out with the fitness apps. And I'm sure that we'll talk more about this during our Hear From You section. But Apple Health Kit is certainly one of the most common fitness apps. This is a framework that's within, our iPhones. It connects to our Apple Watches. It's designed to house healthcare and fitness apps. It allows them to work together and to collate data. And for physical activity, I really like this, with the Apple Watch, that it can differentiate walking versus running or flights of stairs. Although I got to tell you, it doesn't quite get it right when I'm doing really big hikes and a lot of vertical distance. I like that it can calculate swimming strokes for people who like to swim, cycling distance, rolling for people who may be getting their physical activity in a wheelchair. And it also can tell you the amount of time spent standing. So I think that they've done a nice job with the Apple Health Kit. And it's actually through the Apple Health Kit that study I shared with you on heart rate, resting heart rate, and steps. That's how that research project was done. All right, so, I was looking, all right, what are the coolest, newest apps out there, in 2021? And if you Google that, best workout apps for 2021, there's many different places where you can get a list, but many of them are sponsored by a particular app themselves or industry sponsors. And so I decided to pick the list of apps from PC Magazine because they select and review products independently. And so I thought this was a better source of truth. And this was done by a gal named Jill Duffy in late 2020. So here you go. So the best fitness apps according to PCMag.com. And certainly you can look this up and read about these in more detail if you're interested in learning more. For short workouts, their #1 recommended app is the 7-minute workout. We'll talk more about this. Or Onyx, which allows you to kind of design a workout for yourself. There's a lot of workouts on demand. I didn't check out all of these, but these are the top 5 from PCMag.com. There's Shred, Fit On, Forte, Kilo. Nike Training Club is probably the one I'm most familiar with. And they have both, and all of these have both free versions and pay versions. And so I think that's really important. I will say that I never recommend an app to my patient that I haven't personally downloaded and tried myself. And so one of my other favorites, which didn't make the list according to PC Mag, is a app called Sworkit, SWORKIT, Sworkit. And it also allows you to kind of customize a strength training or cardio workout. And I've used the Sworkit app back in the days when I used to travel before COVID. BC, it's taken on a whole new meaning. In terms of activity tracking, there are lots of different activity tracking apps. My favorite one used to be the Move app, and that was actually developed at the University of Pennsylvania. And it was by far and away my favorite activity tracking app, but they no longer support that app, so I can't use it anymore. But Map My Run is another one that is really popular. I like Map My Fitness, and I like Map My Fitness because you can manually enter information about dog walking or lawn mowing or gardening, which is, we talk a lot about the difference between physical activity and exercise. And, lots of people don't see those things like dog walking, lawn mowing, and gardening as exercise, but they certainly are. And they definitely add up to the 150 minutes per day that is recommended by the Physical Activity Guidelines for Americans. Charity Miles is super cool too. So you can accumulate miles and with it money, and you can donate to charity. And then there are some great workout music apps. Rock My Run and Fit Radio. So one of my friends uses Rock My Run. And what you can do is you can figure out what is the cadence that you like to run. And then you can enter that cadence, or I think it identifies the cadence in which you're running. And then it'll suggest songs to you that are actually the same cadence as your running steps. And so my running friends really like Rock My Run because you can customize the music based on how fast you're running. Okay, so I want to talk a little bit more about the scientific 7-minute workout. This is definitely my favorite app, and it's had 10 million downloads, and it's been reviewed by over 350,000 users. This is what it looks like on my phone, and these are the various exercises in it. What I like about the 7-minute workout is you don't need any special equipment. All you need is a floor, the wall, and a chair. You need nothing else for it, and you can do it anywhere. I've done it in hotel rooms pretty much all across the world. It starts out with jumping jacks, then do a wall sit, push-ups, abdominal crunch, step up onto chair, squats, tricep dips, planks, high knees running in place, lunge, push-up with rotation, that's a little tricky, and the side plank. And I generally do it twice when I do the scientific 7-minute workout. And that seems to really kind of get my heart rate up there. So why do they call it the scientific 7-minute workout? Well, it's considered a high intensity circuit training using body weight. And it was developed by these two gentlemen, Brett Klika and Chris Jordan, and it was published in the American College of Sports Medicine Health and Fitness Journal back in 2013. And so I put the reference there if you're interested in reading more about that. But it became popular when Gretchen Reynolds, who is a reporter for the New York Times, wrote an article about it in the New York Times Magazine in May of 2013. And it was the 6th most viewed 2013 article in the New York Times. So that's when it got really popular. And so now people, of course, are studying it to see, is there any science behind this workout? And in fact, a study published in the Journal of Strength and Conditioning Research by Michelle Riegler found that, it does meet the level of vigorous intensity. And another investigator looked at the effect of the 7-minute workout on weight and body composition. This was published in the Journal of Sports Medicine and Physical Fitness in 2017 and found that it favorably impacts body composition. So in fact, it is the scientific 7-minute workout. All right, so moving on to healthy eating apps. There's a lot here. And the article from PC Mag also talks about some of the healthy eating apps that are out there. I'm just going to share 2 with you. One is MyFitnessPal, and this has been around a long time. I actually do recommend this for patients sometimes. I have to be a little bit careful, but I do recommend it because it has the most extensive database of any of the diet tracking or food tracking apps. It has a database of more than 5 million foods. And almost any restaurant you can come up with, except for maybe a very local, mom and pop shop restaurant. But if you go to any type of national chain, their chicken sandwich is likely to be on MyFitnessPal. So that's a great one. I think you probably have to be living in a vacuum to not know about Noom. Noom they've done a lot of direct-to-consumer advertising. They call it a behaviorally based weight loss program, and they've had some success with some celebrities, who are certainly talking about Noom. And Noom, I think, has done a pretty good job, actually. There's some science behind their marketing, and they have multiple peer-reviewed publications in scientific journals looking at how their program can, in fact, deliver on the hype. So I think Noom is another app and program worth considering for people who are trying to achieve a healthier body weight. It's certainly not for the faint of wallet. It's not free by any means. There's lots of discounts though. And what I've heard from my patients who have done Noom is to always wait until they have a coupon or they have a reduced price option. Because as you can see here, and I just took this off of their website yesterday, you can definitely pay less than the list price. Now, this may seem, expensive, but I do want to just call attention to the fact that, adults with obesity in the United States, compared to those with normal weight, they do experience higher annual medical care costs of about $2,500. So, an annual or recurring plan for $200 versus $2,500 a year, if you kind of fall into that obese weight category. So it's probably worth the investment. What about mindfulness, sleep, and stress reduction? Oh my gosh, during the pandemic, I've recommended a lot of these apps for people. And I think probably the ones that are most well-known and most popular are Headspace and Calm. We talk a lot about this, in our work with mindfulness, and Headspace very graciously provided the app free of charge to healthcare workers during the pandemic. I definitely took advantage of this. I have both of these downloaded on my phone. I kind of like Headspace, and I was a skeptic on this whole mindfulness thing, but I am a total believer now. And I love that I can do a 1 minute or 2 minute, and sometimes even a 5 minute mindfulness exercise on Headspace. and I can just feel the tension coming out of my body. So I'm now a believer, and I talk to my patients all the time about these apps. So now we are down to hearing from you, and I would love to hear from you. What is your favorite app and why? And maybe what I'll do is I'll actually come out of screen sharing, Lynsie, and I'll try and take a look at some of the chat topics as well.
Looks like Jessica has a couple she's willing to share. Jessica,
Hey,
I don't know if you want to type it in the chat or come off of mute.
Yeah, will you come off mute, please?
Oh, you know what? I just realized I might actually have to take her off of mute. I think they're hard muted. So let me just do that really quick. Hang on one second. Love technology. Okay. Jessica, I have allowed you to come off of mute.
Great. Thanks, Lynsie. Well, first, I won't take up too much time, but I'll just give my personal endorsement for Headspace. I too took advantage of the free membership during COVID for healthcare workers and can relate to the skepticism, but have really enjoyed that and have even, you can friend people in Headspace. So friended some of my colleagues and coworkers so we could nudge each other throughout the pandemic to kind of keep on with our meditation streaks or our mindfulness streaks. But the one that I also wanted to share is one that I don't hear about a lot, but I have it myself. I kind of like Dr. Joy, don't usually recommend things that I haven't downloaded and experimented with myself, but it's called Shapa, SHAPA. And it's kind of an all-in-one. So you actually, when you join, get a scale that's a biometric scale. So it's doing weight and also body composition. But the thing I love about Shapa is there are no numbers on that scale. So you can do a daily weigh-in, but you don't get that reaction that kind of, for a lot of people, can dictate how the rest of your day goes based on that number on the scale. So Shapa is tracking it all. It provides you kind of like a progress color so that you know if you're progressing according to your goals and maybe at what rate, but the colors are not even like the typical red that we could, kind of the stoplight approach. They don't do that stoplight approach where red is bad. And so right now your color's bad. And I like that it's taking into account more than weight, because for a lot of people, our body composition changes as we make more healthy decisions. The other thing it does is it can connect with other apps, but you're also can track your like a mindfulness approach to eating. So it has that intuitive eating scale in it where you can rate whether you're ravenous or how you felt when you ate throughout the day, which I really, really like. The other piece is it sends you daily missions. So 2 missions, you actually, they call it Shapa Science. And so based on whether you want to participate in that mission or not, or if you struggle completing a mission, over time, it will really curate your missions and you can choose to participate or not. And some of them are several days, like drink a glass of water when you wake up, or some of them are physical activity based. Some of them are nutrition based, like try to eat a green food every day this week, or some of our environment ones. So like put a positive note on your computer screen and you can really customize that. So I really liked that one because it's focusing on, a lot of us do want to focus on weight or moving in that direction, but it brings the whole picture together and allows you to create little goals and change little behaviors. And then you're not beholden, it's tracking real biometric or anthropometric progress, but you're not beholden to that number on the scale that can be really frustrating for a lot of us. So I'll pause there.
I love it. Thanks so much for sharing that, Jessica. Like I said, 200,000 apps out there. Definitely don't know them all, but that one sounds, it's very intriguing. I know we're right at 5:30, but I wanted to give somebody else an opportunity to share, one of their favorite apps. Lynsie, do you have one?
Yeah, I can share one. So I maybe am the minority that didn't love Headspace, and I can't even explain why, but really wanted to focus on mindfulness in 2019. So kind of went on a search for what other mindfulness apps are out there and came across one called Insight Timer.
Okay.
And I love it. I love it. It has short meditations, it has guided meditations, it'll just play music and you can do your own meditation. I am kind of a creature of habit, so I found one that I love, and I probably have it memorized now because I just do it over and over again, and I know exactly what's coming next, but I love that. And so Insight Timer is my recent 2020, 2019, 2020. I found it in 2019, but really used it in 2020 for mindfulness and have really liked it.
So that one does make the list of best apps for kind of mindfulness meditation. So it's also quite popular and gets high ratings. So not surprised. Yeah. All right. Well, we are at 5:31. Want to respect everyone's time. Thank everybody for joining us. You can go to the Healthy at Home website and learn about our next Live Well webinar. I was going to look ahead of time, but I forgot to see what the next topic was. A few more are showing up here. Breathwork by pause. Awesome. Okay, excellent. Well, thanks everybody for contributing to our Is There an App for That? And everybody have a great night. Hey, Lynsie, thanks for moderating tonight.
Yes, and let me go ahead and stop the recording. So just thank you everyone for joining. So happy to have you here. We're gonna post the recording on the Healthy at Home website, right, Dr. Joy?
Yep.
So if you want to come back and listen to it, or you want to remember what that app was that she talked about, the recording will be there. So I'm gonna go ahead and stop that